Nation, welcome back. Happy New Year for the third time. I did 2 videos yesterday. When is it too late to say Happy New Year?
I don't know. Did you say Happy New Year on Happy New Year for a video?
I didn't do a video on New Year.
Oh.
January 8th were my first ones for the year.
You should have. They could have saw you inebriated.
And then a live stream would have been better.
Oh.
Yeah. So 2018, the year of collaboration so far, right?
Mm-hmm.
We've had what, 4 working days? 4 working days in the new year, or at least since I've been back. And I've only been healthy for 2 of those days. But every day we've gotten calls from people that involve some kind of collaboration. Either they want to collaborate with us, we want to collaborate with them, or they're trying to collaborate with other people in the industry, right?
Mm-hmm.
And yesterday I talked about this ecosystem for people looking to get into the space, or people that are already in it looking for creative ways to monetize. For example, sites that specialize in, let's say, psychiatry, but want to diversify into general medicine, devices, diagnostics. How do they do that? Well, collaborate, right?
Sure, that's one
So
way.
how do you do it? Let's do it for the sites first, then we'll do one for the people that want to be CRAs, then we want to do one for the CRAs that want to be consultants, and then we'll do a quick one for the CROs, just really quick.
So
You're a site, you want to diversify into other fields.
So am I an MD or am I just the owner of the site?
Either.
Well, MD, reach out to your colleagues.
What's
Well, I guess
the
it's
purpose?
the same thing, right?
What's the purpose though? Like, what's the collaboration purpose there?
Well, you're trying to expand in general medicine, right? Maybe you could find a family practitioner, GP, something of that nature, right? And then if you're the site owner, well, you hit up your PI. Hey, do you have any colleagues that could help us out in this venture?
Yeah.
Right?
And this is why we say, when you're an entrepreneur, you're, even in this space, you're a salesperson first, and then you're a researcher, right?
Or at least equally.
At least
Very
equally.
minimum.
At least equally. And if you don't have any sales skills, you're not going to be able to collaborate, because you're going to be looking for, first of all, you're not going to know how to present your opportunities.
In the scenario we just described, you could ask the doctor to reach out, right, the PI. So they could do the salesmanship for you, but typically you'll be doing it yourself.
As we know, that doesn't work very well.
It does once in a while.
Once in a while, like if you catch the doctor at the right time.
Right.
If you want something done,
Gotta do it yourself.
thank you. So that's one way to collaborate. You're a research site, you're doing, let's say, Alzheimer's studies, you want to now start doing diagnostic studies or nutraceuticals. Go find a doctor who does those kind of things. Doesn't have to do those studies, just has to be in that world. Maybe they're a key opinion leader in that space, right? And they can introduce you to the medical liaisons, they can introduce you to people you may know, or they might put you on the right track. And then when you do meet those decision makers, you can leverage your relationship with this new person that you've collaborated with, and it's all easier, okay? Now, let's go with people that want to be CRAs. How do they collaborate? The first person I think you need to collaborate with is a recruiter of some
You
sort.
took my answer away.
Right, so go ahead.
I don't have another answer. Recruiter, right? I mean, that's about it.
Networking.
I-
That
so
would
there
have
is-
been mine.
There's another way too. So when I first entered this industry, I was hit up by a few different CRAs that were monitors for the site, for a study we were doing, and said, hey, have you ever thought about being a CRA? So you can become a coordinator, right?
Yes.
In order to open the door to be hit up, and also ask, hey, is your CRO currently hiring? So you know to reach out. So a form of networking, but they'll also come to you directly.
Right, so if you want to be a CRA but you have no experience in this industry,
Not even necessarily no industry experience, but helpful, of course, to become a coordinator first. But even if you're having a hard time finding a position, you have previous CRA experience, you could still, I don't think it'd be that difficult. I don't think you need to become a coordinator. You just reach out to a recruiter, they'll get you a job. But if you,
They'll try to get you a job.
That's not working for you, you could become a coordinator just to open up the doors to networking. Right?
or you become a patient recruiter. That's one of the lowest hanging fruits. Don't get that confused with a recruiter we just talked about, where they're recruiting you to work for somebody. You can become a patient recruiter, work for research clinics, prove yourself there, bring them patients. I've been talking about this for years, and then work your way up to being a research assistant and then a study coordinator. Another thing I want to add is network. Go to SOCRA meetings, go to ACRP meetings. Most major cities have chapters in your area that you can go to. Most of those are free. You could pay to be a member. You can network on LinkedIn and Facebook. There's plenty of groups on LinkedIn and Facebook where you can literally network from your bed in your pajamas. You couldn't do that 10 years ago.
Oh, yeah, always
You had
nice.
to go out somewhere, dress up, right?
Mhm.
Meet people face to face. Now you can do that on LinkedIn. You can do that on Facebook. You have Twitter groups. Network, okay? That's not going to cost you anything. All right, so those are those people. Now, what about CRAs that want to either start their own sites or want to become consultants? They're sick of being W-2 employees. They want to be contractors, right? Or consultants. They want to branch into other areas, not just monitoring.
Mhm.
Who do they collaborate with?
Well, they have a number of physicians they worked with in the past as a monitor, so they can always hit those individuals up.
Hit up those PIs that you
Yeah,
monitored,
and
right?
say, hey, would you be interested in collaborating on a site?
Or do you know any doctor who would be interested?
Sure.
That's not in your specialty, so we don't compete.
Right.
Right? Okay.
As far as venturing out into consulting,
Yeah.
you got me there.
We know what we have one here.
You
We have a
do?
monitor that comes here. You just talk to him.
Yes, that's contracting work, not
Mhm.
consulting work necessarily.
He does that.
Does he?
Yeah.
I wasn't aware of that.
Yep. So he started out as a coordinator,
Yes.
right? Then he worked his way to a W-2 CRA. Now he's a 1099 CRA. And he's also done a lot of consulting. He's had consulting gigs.
Yeah.
So he's
I
helped-
didn't know that.
He's helped protocol submissions, like different things like that.
Mhm.
He's done that. And he did that by networking, right? Collaborating. Like
Sure.
every time you go to a site, just think, okay, who's here that I can possibly collaborate or network with in the future? Go to conferences too. If you're a CRA, go to the ACRP, local chapters, go to the SOCRA, go to like 1 or 2 conferences every year, right? Scope, Magi, those are good ones.
More than likely, his employer thought he did a good job, previous employers, and came back to him and said, hey, we need help with this particular topic,
Correct.
and asked him if he'd be interested for, a short employment stint.
Always
As a
be
consultant.
looking, always, you never want to limit yourself. I got a contract CRA position last year, and it already evolved into auditing position,
Mm-hmm.
right?
Mm-hmm.
Now it's going to be protocol writing, right? That we can piggyback that experience now for
Sure.
other projects that we're doing.
Mhm.
So always look for different angles. There's always an opportunity. Never turn down an opportunity. Even if you think you don't want to do it, just think about it for a while, right?
Sure.
And then see if you may know somebody who may want to do most of the legwork, but you can still be involved somehow. Multiple streams of income. That's for you entrepreneurs out there. And then last one, if you're a CRO or a biotech or a sponsor and you have no clue what you're doing, maybe you're planning your first clinical trial,
Mhm.
obviously you can't do it all in-house. You're gonna need to collaborate. Google's a good way to do it. Find me, YouTube, LinkedIn, conferences, right? There's a big conference going on right now, JP Morgan in San Francisco, it's a biotech conference,
Mhm.
and I'll be interviewing one of the guys there. He's one of our clients from Spain, but why do you think he flies all the way from Spain to San Francisco?
Yeah.
Network,
Absolutely.
collaborate,
Yeah.
right? Anything else?
Yeah, it covers it.
I feel like the economy's shifting, the industry's definitely changing.
It's improving in the sense of more opportunity.
More opportunity this year is going to be huge. You can't do it all yourself. You got to collaborate. You got to find the right partnerships. And there's plenty of opportunities out there. You just got to be creative. Very much related to the video I did yesterday. Think outside the box, right? Anything else, sir?
No, nicely put.
All right. Thank you, everyone, and we'll catch you later. Bye-bye.